Over 30,000 cases of syphilis are reported in the United States annually, 2/3 of them amongst homosexual men.
Syphilis is a sexually transmitted disease caused by a bacteria known as Treponema pallidum. Syphilis is curable, but if allowed to progress without treatment, it can result in serious illness or death. Syphilis has been around for centuries and has infected some of history's most famous individuals: 18th century composer Franz Schubert, England's King Henry VIII, and 1920s gangster Al Capone all had deadly cases of syphilis. Today, the bacterium spreads the same way it always has, through direct contact with a syphilis sore, which are usually located on the genitals. For this reason, syphilis is usually passed sexually, although a pregnant woman infected with syphilis may also pass it to her baby. If a person contracts syphilis, it can go through 4 stages, particularly if left untreated. The first, or primary stage, is marked by the appearance of a painless sore or chancre, about 20 days after infection. Within a week or 2, the chancre usually heals on its own, but because a syphilis lesion increases the risk that a person can contract HIV by 5 times, abstaining from sex at this point is vital. After the chancre heals, the secondary stage of syphilis begins. A painless red or brown rash may appear on the body, especially on the palms of the hands and bottoms of the feet. The secondary stage is also characterized by flu-like symptoms, including fever, fatigue, and aching muscles. Because these symptoms are often indistinguishable from other diseases, syphilis is known as the great imitator. These imitation symptoms will usually resolve themselves without treatment within a few weeks. The third, or latent stage of syphilis, begins when secondary symptoms abate. At this point, there are generally no outward signs of syphilis, but the bacterium continues to thrive internally. If syphilis is not treated, complications of the disease can result in a 4th stage called tertiary or late syphilis. This can spread to other organs, resulting in neurological problems like a stroke, paralysis, deafness, or dementia. Cardiovascular difficulties like inflammation of the heart's major artery, the aorta, may also follow from untreated syphilis. Eventually, these conditions can lead to death. The good news is that penicillin has been found to be a safe, effective treatment for this disease. A muscular injection of penicillin, sometimes with booster shots, is all that is needed to kill the bacterium that leads to syphilis. Your doctor will follow up with blood tests to be sure that the medication is working. Pregnant women will be tested more frequently to ensure a return to health, as syphilis can cause death in newborns. Talk to your doctor about getting a blood test to check for this disease.
If you thought that clip was interesting, check out all of our videos only at sexhealthguru.com.